My name is Lillian Villamizar. I worked as a quality assurance analyst for 23 years in Amadeus, a travel technology company here in Miami, but I retired in 2016. In May of 2012, at the age of 57, I found a lump in my left breast, but didn't think anything of it. I checked the following month, thinking it would have gone away, but no such luck. I had skipped my mammogram the year before because I was too busy worrying about a tumor that was found in my parathyroid. I had it removed. After finding the lump, I decided to book my mammogram as soon as possible. I had a 1.2 centimeter irregular mass in the left breast, highly suggestive of malignancy. An ultrasound-guided biopsy was done on June 27, 2012. And an infiltrating ductal carcinoma was found. I had a left axillary aspiration that was positive for metastatic carcinoma. This was the beginning of so many doctor visits: oncologist, radiologist, oncology surgeon, and plastic surgeons. I almost needed a secretary to keep up with all my visits. I couldn't get an MRI because I only have one functioning kidney. So they scheduled a PEM on July 11, 2012. That showed an abnormal 2.3 centimeter left axillary lymph node. I had a mastectomy done on July 24, 2012 at Baptist Hospital. I was so grateful for Dr. Grace Wan, who was my oncologist, and helped guide me through the process. My surgeons were Dr. Manuel Torres Salich and Dr. Rafael Garinger. I had 20 lymph nodes removed, of which only one came out positive. The metastasis measured 2.2 centimeters. After 2 months at home, I returned back to work and was scheduled for the reconstruction in November. What I remember being the most painful was the expanders that were put in before the reconstruction. I had to visit Dr. Godinger almost every week to have my skin stretched. I never looked forward to those visits. In November 2012, I had the reconstruction done. Since I only had one functioning kidney at the time, it was recommended not to have chemotherapy and instead was given hormone therapy. I started on exemestane for a couple of years, but then had a lot of pain in my joints and was switched to letrozole. Joint pain is still there, but I decided not to complain since I could have had many other side effects. The only history of breast cancer in my family was my great-aunt, who had a mastectomy in the 1960s, and she lived to be 102 years old. The following year after my surgery, I was invited to the Day of Caring for Breast Cancer Awareness event by the Diagnostic Center for Women. I was so impressed with the event that I decided to volunteer the following year and was recruited in my first meeting as a model. I've been with them for the last 8 years, and it's been such an honor for me to work with these dedicated ladies. I've also met so many wonderful people who have had breast cancer, and I'm in awe of their resilience. My motto is, healing is a job, but thriving is a career move. Although I've recognized death, I've chosen to celebrate life.